Hi, good folks. I am Tim Swindell with Mid-South Medicare Advisors. I want to welcome you and thank you for your time as you join us for this presentation of Making Medicare Simple. I had a friend call me one day. He was very frustrated. He said, "Tim, I need your help. I own a multi-million-dollar trucking company. I understand IRS regulations. I understand Department of Transportation regulations. I cannot make sense of Medicare." Well, most likely you've begun to research Medicare and also find yourself on a spectrum of confusion. In the next few minutes together, we will help remove that confusion and give you the tools needed to take the next step. Before we begin, let me set the stage for our meeting. This is an educational only event. There will be no sales activity and there is no obligation whatsoever. So please jot down any questions you have during the meeting and be sure to note my phone number and email address at the end of the presentation. The goal is to answer all your questions and equip you to determine the Medicare solution best for you. Remember, individualized guidance is our specialty at Mid-South Medicare Advisors, so please reach out with any questions. I truly look forward to speaking with you in the near future. All right, grab your notepads and let's get started. Welcome to Making Medicare Simple. First, let me introduce the mission of Mid-South Medicare Advisors that I have borrowed from C.S. Lewis. It is not your business to succeed, but to do right. When you have done so, rest lies with God. This is our unwavering cornerstone. I have been in the insurance industry for 30 years. Many of those I focused on group health insurance in the early years, but 14 years ago, I purposed to specialize only in Medicare insurance by joining Humana's Market Point division, which focuses solely on Medicare. Although these were great options, it did limit my client solution simply because I did not have access to all the Medicare options in the market, but only Humana. So 8 years ago, with the purpose of providing a no-cost, independent, unbiased, full market resource for folks like you, I founded Mid-South Medicare Advisors. At Mid-South Medicare Advisors, Medicare insurance is our only business. No life insurance, no annuities. We are laser focused to provide the best possible Medicare expertise. And this results in 3 no-cost, no-obligation offerings. First is what we're doing with this presentation, education. This is to help you with a general understanding of Medicare. Secondly, consulting. At your invitation, we will gather information concerning your specific situation, such as doctors, prescription needs, and desired optional benefits. We then will take that information, research the full market, and present you with the findings. This report will show the 2 Medicare options that address your detailed needs, highlighting the lowest prescription costs of all the available carriers within your zip code. Lastly, if you wish, I am also available to enroll you in the Medicare solution that you have determined is best for your specific situation. Our agenda today, first we'll talk about Medicare sign-up, when, where, how, also the 2 Medicare solutions that are available to you, and then we'll go through the finer points of Medicare. The first thing you need to know is that when you move to Medicare, you are moving to an individual coverage. There are no family plans like group insurance where you have husband, spouse, or family type plans. On Medicare, everybody stands individually. Who is eligible for Medicare? Well, you must be a United States citizen or legal resident for at least 5 consecutive years and one of these. Age 65 or older, you can be younger than 65 with a qualifying disability, or at any age with end-stage renal disease or ALS. So when do I sign up for Medicare? Well, it depends. The number one confusion that I deal with each and every day is if you don't sign up at age 65, a penalty may be incurred. And you're going to hear this from all your friends, and that is the number one misconception. In fact, Social Security publishes this. It says if you don't sign up for Medicare at age 65, you may have an enrollment period for a penalty for as long as you have it.
But that is not true. Not if you have creditable group insurance coverage. So basically, any of the today's group insurances are deemed credible. You do get a notification each year that tells you that it is. One note here, if you have VA health care, that is not creditable for Medicare Part B. But when do I need Medicare Parts A and B? Well, it simply is when you use Medicare for your health insurance. You need it when you use Medicare for your health insurance. So let's take a few scenarios. First scenario would be that you are turning 65 and you will be using Medicare for your health insurance. Now, know this, if you have started drawing your Social Security already, they will automatically sign you up for Medicare Part A and Part B. You must keep Part A. If you are coming into Medicare for your health insurance, you would also keep Part B. Now, the initial enrollment period revolves around your 65th birthday. So 7-month period, 3 months before your birthday month, and then 3 months after your birthday month. You can sign up in a couple of ways. First, you can sign up online at medicare.gov, or you can call your local Social Security office. If you sign up online, it's fairly simple, especially if you have your My Social Security account already set up. Probably in and out 15 to 20 minutes with that. Of course, the local Social Security office, a lot of them are doing phone interviews now. So that's the two ways. Now, what if I am working after age 65? Well, of course, you can choose to keep your group insurance, or you can move to Medicare. And of course, that's um, a decision you make by making that comparison. Now, if you continue to work and keep the group insurance, it must be creditable group, which allows you to avoid the penalty. Now, if you're over 65 and you have group insurance, and that group insurance has a health savings account attached to it, you do need to know one thing concerning Social Security. If you want to draw Social Security and you have an HSA, if you're contributing to it, then you more or less choose your health savings account or your Social Security payment. If you get any part of Medicare, then any contributions after that point, those do become taxable and penalized. So that's one thing that you do need to know. And if you are in working after 65 and you want to enroll, well, you do determine when you want to move to Medicare. You are not locked into the group annual enrollment. The first of any month, you may come out of the group insurance and roll into Medicare. And again, this is if you are working past the age of 65. You would enroll in Medicare Part A and or Part B. Then you would, after age 65, you would need to secure an insurance verification form from Human Resources. Now, this is the form that keeps you from any Medicare penalty, and it's simply a one-page form saying that you've had insurance since back before age 65. And then you enroll in the Medicare insurance that is health insurance that is best for you, that you deem as best. So what are my Medicare coverage options? Well, it's kind of an alphabet soup. Part A is hospital. Part B, doctor and other medical services. Now, this is your Medicare card. Your red, white, and blue card has Part A and Part B. Then you choose whether you want Part C, which is a Medicare Advantage plan. A Medicare Advantage plan is like your group insurance. You have one card, prescriptions and medical together. You have a network of doctors and hospitals. Then Part D would be prescription drug plan, and then Medicare supplements. Now, these come in not parts, but plans from A to N. So you can see all the alphabet that's happening there. So Part A, Part B is your Medicare card. Part C is a Medicare Advantage. Part D, prescription drug coverage, and then your Medicare supplement. And here's a chart we will refer to multiple times here. If you look at that, the first column is the red, white, and blue Medicare card, A and B. The second is basically your first road you can go down or option, which would be combining your Medicare card with a Medicare supplement to complete the medical side, and then adding a prescription drug plan. Or option two, which is only the third column, would be the Medicare Advantage. And this would be choosing an insurance that gives you, like group insurance, one card. You get prescription, medical together. There can be additional benefits with this also. So let's talk first about the basic Medicare card. This is what it would look like. Now, with Medicare, any provider, any hospital nationwide that accepts Medicare is in your network. That's huge. That's larger than anything you've ever had an option for. So that's a big benefit here. Plus, you can't be turned down due to your health. That is guarantee issue at that point. Now let's talk about the different pieces. Part A is basically the hospital coverage, which is inpatient hospital care. It does include inpatient mental health care. Skilled nursing services is covered under this, and some blood transfusions, and hospice care is added in there. Now, there is no monthly premium for most folks. If you have worked and contributed to the system for 40 quarters or 10 years, then you would be able to get Part A at no cost. If you have not contributed that long, then there would be a premium, and it's varying in a couple of levels, but it could be quite expensive. Part B is your doctor and outpatient services. Now, this would include things like physician services, your ambulance rides, laboratory services, any outpatient hospital services, whether it be labs or outpatient surgeries. What is not covered? Well, there are deductibles and there are co-insurance amounts. There is a Medicare Part B excess charges that would not be covered. Long-term care or custodial care, nursing home care is not included in Medicare. Nursing home care is not included in Medicare. And like your group insurance, non-medical vision, hearing, and dental, you would need an additional policy most of the time for that. Also, prescription drug covers. Your Medicare card only covers your prescription, only covers your medical side of the drugs. What is your responsibility? Now, you could use this for your medical insurance. If you went in the hospital, you would have a $1,676 deductible for that. Your Part B deductible would be $257. Then you would pay 20% of all Medicare approved costs. And here's why you would not want to do that, because there is no out-of-pocket maximum. It just keeps on going. Now, one thing you do need to know is Medicare Part B has a monthly premium, which is based on your adjusted gross income from 2 years ago. Well, let's see how this works. And this example is from the year 2025. So if you were starting with your Medicare in 2025, they will look back at the 2023 tax return to determine what your Part B premium is. Most folks that I deal with do file jointly. So let's look to that column. If that adjusted gross income line is $212,000 or less, the premium for your Part B would be $185. Again, this is for the year 2025. As you go down the line there are 5 more slots, and you can see that it does ramp up with each income bracket. So it could go all the way up to $714.70 per month for the Part B premium. And again, let me remind you that if you are married, that this is individual per you and per your spouse. So let's talk about the first option, the first road. When you come into Medicare, once you get your Medicare card, there are 2 roads you can go down. The first option, we're going to be taking your Medicare card we're going to pay all those deductibles and the extra 20% and all that. We're going to pick a Medicare supplement to be able to take some of that away. And then we're going to add a Part D prescription plan. So again, here's our chart. What we're looking at is column 1, column 2. That is our first solution, our first road we can go down. So let's talk about the Medicare supplement side of this. For Medicare supplements, you must medically qualify except your initial enrollment into Medicare, and then you would have guarantee issue. As we talked about previously, it's the largest network that's ever been available to you, and that's any provider, any hospital nationwide that accepts Medicare. And you do need to know that benefits are paid by a Medicare supplement if Medicare covers the service. If Medicare takes a service and said, no, this is not covered, we're not paying, then the Medicare supplement will not pay either. So Medicare supplements only pay if Medicare deems the service covered and they pay their part. These are offered by private insurance companies. Now, the available plans here are plans A to N. You do need to know this, that the government is the architect of these. So they decide what an A is, what the G is, what an N is, and we'll be talking and focusing more on the G in any specifics today because that by far is the most popular one plan that people go with. But anyway, plans A to N. So basically any company that are selling these, if it's a plan G, everybody is selling the same exact plan. Now they can add some additional benefits, discount programs, that type of thing, but they're all the same as far as the base coverage. These help to cover some of what Part A and Part B don't, the deductibles we talked about earlier. And of course, the more comprehensive the coverage, the higher the premium will be. Now, if you happen to be in Massachusetts, Minnesota, and Wisconsin, those states do have different standardized plans, and we will not be talking about those in this education. To be eligible, generally enrolled in Medicare Part A and Part B, need to be a resident of the state in which you apply, age 65 plus, under 65 with certain disabilities, but I will tell you it will be very expensive to be under 65 for a Medicare supplement. And then people of any age that have end-stage renal disease. And again, as we talked about, the plan, again, I'll go to a plan G, the plan benefits are the same. So each company is selling the same product, as I've already alluded to, but if you were to look at all the companies selling in your state, there are the premiums do vary a lot. It could be up to $100 a month difference between Plan A to Plan Z. You do need to plan that the premiums will increase annually. It will be an increasing cost for you. And then on selection criteria, one thing that you need to kind of understand is the way that I look at this, if I have a client that is coming into Medicare and they cannot change, because once you come into Medicare, it's guarantee issue the first time in. After that, if you want to change, you must medically qualify, and you may not be able to do that. So when I select Medicare supplement plan, I'm trying to look at worst case scenario and say, if my client is in a situation where they can't change, how do I look into the crystal ball and try to decide what's going to be least expensive over a long period of time? So we're looking at things like companies that have a lot of insured in that state in their product. Low entry premium, of course, maybe not, usually not the lowest. And then thirdly, and maybe most importantly, is what has been the historical average increase for that plan. So it's not prudent to say, okay, who's got the cheapest premium going in, because usually that doesn't end up being the cheapest over a long period of time. So we've got a wonderful Medicare product there as far as the medical side of it. You've got a plan with the biggest network, richest benefit that you can get, and that is locked down and solid. But we don't have a prescription drug benefit yet. So let's talk about the Part D side. Now, Part D or prescription drug plans, these are offered through private insurance companies. Now, you need to know they're not just out there doing whatever they want to. Medicare has oversight over them. And in fact, one way that they do that is for the STAR score rating. STAR score rating is issued for both the prescription Part D and also the Medicare Advantage Part C. With STAR score rating, it's 1 to 5. Anything 3 and above is a quality company. Anything below that, then Medicare will be looking at them very intently. And if they have a below 3 score for years, for multiple years, then Medicare will basically make them tell their clients, hey, we are a poor performing plan and you may move elsewhere. Now, possible penalty if not covered. That is true. I have people coming in at age 65 saying, Tim, I don't take any medications. Why do I want to pay for a premium when I don't need it? Well, you could do that, but if you do, there is a penalty for those months that you may not have coverage. So if you started out with no coverage and then 15 months in, you changed and went to a policy, you would be penalized for that time frame. So you can do it, but there is a penalty. Now, coverages vary from plan to plan. Prescriptions vary from plan to plan. They don't have to cover every prescription available in the market. They basically have disease sets that they put prescriptions to of brand name and generics for those disease sets. So the list of drugs or the formulary, it can change each year. And with all these plans, there will be tiers of drugs from generic down through brand name down to specialty drugs. Those tiers will have copays, the plan or those copays could, or the tiers could have deductibles, and coinsurance may apply. Now, if you look at this chart again, it is kind of reiterating what I just said. Tiers 1 to 5 here, your tier 1s are the preferred generics, the tier 2s generics. Usually the brand names start with tier 3 and 4 and then specialty are at 5. And you see on the right there, normally the cost increase as the tier goes up. Now, when you have a prescription plan, there are stages of payment. If your plan has a deductible, and this might be a deductible for every drug, just the first dollar deductible, it might be a deductible for just the brand names for tier 3, 4, and 5. But if there's a deductible, you pay that first. Then you go to the initial coverage. This is where you pay copays or coinsurance amounts on those prescriptions that you get. Now, there has been a change. The donut hole has gone away, and your out-of-pocket maximum for prescriptions is $2,000. Once that is reached, you go into the catastrophic coverage, which they probably need to change the name of that because it goes to zero cost. So it's not so catastrophic. It's pretty good. Then also a new thing that they're bringing in is the Medicare prescription payment plan, which is a new payment option that allows you to spread out your cost if you want to take advantage of that. Now we talked about the Part D. Somebody I don't need it. I'm going to wait and not pick one up. Well, here's an example of that penalty. This person waited for 17 months and then picked up a prescription drug plan. Their penalty was about 34 cents a month, so it's not a lot. This penalty was $5.78. And the prescription drug plan they picked up was $13.20. So the $5.78 is added to that, total paid $18.98. But what you need to know is this penalty is not just for 1 month. It's not just for 1 year. It is from then on, as long as you have a prescription drug plan, that $5.78 would be added to it each month. So that's the danger of not picking up a plan when you first need it. So we've talked about solution one, road one. Let's talk about the second, which is the Medicare Advantage plan or Part C. Now, with this qualifications, you must have Part A and Part B, and you must live in the plan service area. And to think about it like this, Part C combines the Medicare card, A and B. Most do include prescription coverage. There are specialty plans for folks that can get their prescriptions through the VA that don't have it. And with Medicare, like group insurance, they normally do not cover just your regular vision, dental, hearing. Medicare Advantage plans normally will add those benefits in as an additional benefit at no extra cost. So again, with the Medicare Advantage Part C, these are also offered by private insurance companies. They also are star score rated, so they are watched over by Medicare, and their plans have to be approved before they can sell them. And we've talked about the additional benefits there that they can, and most of the time do include the routine vision, dental, and hearing services. Now, with a Medicare Advantage, your plan premiums normally are zero, but there can be premiums. Those premiums and terms can change from year to year. Like your group insurance, you do get one single card that has medical and prescription together. You have a network of doctors and hospitals in which you choose your providers from. And in most, you have a service area of coverage. Now, having said that, if you go to California or out of state and you have an emergency, go to the nearest emergency room, and you would have coverage there as in network. And a lot of these will also cover urgent care if you're outside the area. So that's Medicare Advantage Part C. That's one road we can go down. Let me move back here. So that's the Part C Medicare Advantage. Your other road is our first option we talked about, Medicare card combined with the Medicare supplement and a prescription drug plan. So again, back to our master chart. Option one is column 1 and 2. Option 2 is the last column there, your Medicare Advantage. Those are your Medicare choices after you get your Medicare card. So let's talk about enrollment periods. There is the IEP, initial enrollment period, the SEP, which is a special enrollment period, and the AEP. The IEP is, think back to first part of the presentation, the 7-month period wrapped around your birthday month, if you will. Special enrollment periods, there are many of them. The ones that are most frequent would be working over age 65. You want to move to Medicare. There's a special enrollment period for that, which again allows you to be able to move the first of any month. Let's say you were in one town, you moved across the country. That's a move special enrollment period. So you'd be able to make changes with that. There's all kinds of different specific situations for that. Now, once you're in Medicare, normally you are in for the year, but there is an annual enrollment period that allows you to make a change on an annual basis. Now, by annual change, what I'm talking about are your Medicare Advantage plans and prescription drug plans. The annual enrollment period starts October 15th and ends December 7th. This is simply the time in which Medicare tells the companies you may publish next year's plans, prices, all details, and Medicare enrollees can look at what they have, compare it with what's coming, and if there's something better for them, they can fill out an application, and that change would become effective on January 1st. So that is the annual enrollment period. To help this out in September, you should get an ANOC letter. Now, what that means is annual notice of change letter. And this is right before the AEP enrollment period. This is very good because what it tells you is the plan that I have right now, and it's kind of just a column in the letter that says, here's what's changing, and here are the list of those changes. So you know in one form, basically, what you have, what's coming next, and if that is better, if that is worse, and it helps you to determine if you do need to shop during the annual enrollment period for a different plan. So, next steps, we've talked about the different plans, we've talked about how to apply. How do you put all this together? How do you ensure that you get the right situation for you, for your specifics? Well, you've got four ways of doing that. Of course, you can do that yourself. You can look at all the different companies out there at their plans and ascertain everything yourself. Just look at the buffet of products and figure it out. Also, you could talk to an insurance company agent like I was at Humana. Now, those folks know their business, but as I've told you early on, the reason that I started my own business because they were going to give you the best of what they have. So you're going to be limited in whether that will be best for you or if that will be the least expensive best in the market. The third here is what I call the independent general practice broker. Normally, this is an insurance agency, that sells auto, home, life insurance, all the different things, and they'll have a uh, person that sells Medicare. Normally, these types of situations, they do not give you many options. You may only get a look at 3 to 5 companies in their look in that. And the last here and what you're really trying to get to is a specialist broker. If you can find somebody that specializes in Medicare and key that they research the full market for you, that's what you need to find. That you're never going to know if you've got the least expensive, best solution if you're not looking at everything out there. And this person can help you with that. That specialty broker, anybody that can sell Medicare, they have passed a certification program, which is about 40 hours. And if they don't pass that year to year, they cannot stay in business. You can't sell the next year. But with a specialist broker, and here's where it comes in key, um, each company that they add, they have to do their certifications, their product trainings, to be able and pass those to be able to sell that company's product. So, just for instance, all the companies that I deal with, that I have to train with and certify with, I spend about 80 to 100 hours a year in doing those trainings and getting those certifications. So just know that. Now, I'm sure you still have questions. The last slide here will have my contact information on it. If I've failed to answer your questions, and I've failed in my mission here, so feel free to reach out to me. Never charge for anything I do, and I would be honored to serve you with that. But before we go here, if you are the person out there that is looking at this and you are about to retire, I would encourage you to get a philosophy of retirement. And I'm going to share with you mine. And if you want to use it, that would be glorious. But I thought it was a good way to retire when I get there and roll out. I thought this one was funny. Officially resigning adulthood, how to make decisions, how to settle arguments, and then I'm going to recess. I hope you found this education helpful. If you have, please tell others. And again, we are at no cost for anything that we do. Our website is MidSouthMedicareAdvisors.com. If you're watching this, you're probably watching it off of our website already. You'll also find Tim Talks, which are just 30 of the most frequently asked questions that we've gotten in our career, and just short 1 to 2 minute video answers to them. Of course, our phone number there. Again, I truly appreciate the time that you have invested in this. I hope you're having a wonderful day in God's richest blessings.